from London. How realistic is this? I mean, we're very glad that he's not more seriously unwell, but how realistic is it for the Prime Minister to continue to lead the government?
Well, Richard, a lot of the government's activities had moved to video conferencing and calls because of the self-isolating and wanting to set an example to the public at large. And it's not just Boris Johnson, it's also his Health Secretary, Matt Hancock, who just a few hours after Boris Johnson made his announcement said that he too was experiencing mild symptoms and had tested positive for coronavirus. Then we heard that Britain's Chief Medical Officer, Professor Chris Whitty, was experiencing symptoms that he thought suggested he had coronavirus too. So those are the three individuals really at the helm of this country's strategy on combating the virus. Boris Johnson says that he's determined to continue doing his job as it is. I know that people inside Downing Street are hurrying over to his office, leaving food, leaving documents, knocking at the door and then running off again. That's how things are being done. And he's conference calling with his cabinet. We also know that if Boris Johnson for some reason couldn't continue in his role, and this is the early stage of him having this virus, that Dominic Raab, the Foreign Secretary and First Secretary of State, would be, as it stands, the person to take over in that instance.
Know that he's doing okay and that there is a line of succession in place. But I heard the press conference and there was a very good question asked to Michael Gove, the Cabinet Minister. Basically this: since the Prime Minister, the Chief Medical Officer and the Health Secretary all have got it, doesn't it beg the question that they were either foolish in their social distancing or they were either foolish or negligent?
It was a very powerful question, especially as Boris Johnson was seen as early as last night. He went out onto the steps of Downing Street, a few metres away from the Chancellor Rishi Sunak, who himself is not self-isolating at the moment, in order to clap for the NHS, the British Health Service, which every country is appreciating their health service at the moment, but in Britain the NHS is a national symbol and a national treasure as well. He said that he wanted to partake in that, so he was outside Downing Street clapping despite knowing that he had symptoms of this just before he was tested. It does beg many questions. Of course, world leaders and leaders such as Prince Charles as well have many public engagements. They're a lot more exposed even than the average person. But people are asking the question as to why he didn't take his own advice. Boris Johnson was scolded by the medical community for proudly stating that he was still shaking hands just a number of weeks ago. It is a critical situation for a government to be in, to have three of the most significant individuals who are looking after this being positive for the virus, most likely. So we'll just have to see how that pans out, Richard. But it's also important to note that in the UK, constitutionally speaking, the cabinet makes policy. It's not just the Prime Minister, so that will continue as usual.
Bianca, finally, the way in which the numbers, listening to the press conference, the number of people doubling in the United Kingdom, we're starting to hear reports of people who have passed away because there wasn't a ventilator or there wasn't the facilities. And the UK is not believed to be at the apex yet, is it?
No, it isn't. And we don't know quite how far off the peak Britain is. Obviously, every country is trying to flatten that peak. In the press conference today, Michael Gove announced that it seemed that the infection rate in the United Kingdom was doubling every 3 to 4 days. And the Deputy Chief Medical Officer, Jenny Harries, said that Britain won't expect to see any kind of positive movement in the figures, any kind of mitigation of the death rate for at least a couple of weeks, because that's when the measures that the country is taking will start to have an effect.
Right.
In the meantime, you referenced the capacity. I've been speaking to members of the NHS deeply concerned about their own protective equipment, about the access to ventilators. Many hospitals that I've been speaking to, not just in London but outside, already at capacity, and we know new hospitals being built, such as the NHS Nightingale at the Excel Centre, which will have a capacity for 4,000 beds, and now 2 other locations have been confirmed, scouted out by the Army, to also build hospitals there as well, to try and create that capacity so sorely needed right now.
Bianca, thank you. Have a good weekend. Bianca Nobilo, who is in London. Julia should be back with me, and